Hello, good morning and welcome to new followers. Happy Friday everyone. It's lovely, it's the weekend. So I wanted to talk today a little bit about microneedling. So I'm here in all my bare-faced glory because you've got to do it on a bare skin. I've been talking a little bit about microneedling recently and I thought it would be useful to do a demo. Gosh, my nose is shiny. For new followers, it's a little bit... This is not my norm at all. I usually like to do quite a lot of au naturel as much as possible. I do like a little bit of invasive beauty, but I veer towards more the natural route. But this is something that I've tried and it's worked for me during lockdown, so I thought it was quite nice to share it with you. So microneedling, derma rolling, it's an in-clinic treatment as well as you can do a home version. Now I had the in-clinic treatment done on my décolletage with the brilliant Dr. Sophie. She did a terrific actually treatment for me, all here, which I wrote up in the Daily Mail, and I just before lockdown actually, and I was supposed to continue having it done, but obviously I haven't been able to. But I was so impressed with the results, I wanted to try a little bit at home on my face, because I know for years it's been used as a lot of facialists use it as a red carpet facial to really make the skin pop and to really give it an extra glow. As I say, I wasn't a fan of it, but especially for at-home use, but my head has really been turned actually. Now it's not for everyone. If you've got very, very sensitive skin, or your pain threshold is pretty low, then it's probably not for you. I have got sensitive skin and I found it totally tolerable and effective, but I definitely think it's an approach with caution subject. So here is the at-home derma roller. This one was sent to me by the lovely Olivier Wilson company, which specializes in micro rollers, derma rollers. They start at 0.3 millimeter. It's essentially what you need to have the little titanium needle. It's a roller with little titanium needles. Now you need them to be made of titanium. You don't have to purchase a really super duper expensive one, but you do have to purchase a safe one. You can get them on Amazon. This came from Amazon, and do look for an FDA approved sign on that. And also when you open it, check. It should come, as the Olivier Wilson ones do, that they should be hermetically sealed like this, so you know that you're getting something which is totally clinically clean and ready and safe for use. If it's not packed like that, I personally wouldn't use it. I would send it back. So just to recap, the in-clinic treatment is done with not a handheld device. It looks like a pen and it's a rotating roller, or it can just be stamped in. As I say, the needles go from 0.3 millimeter to an eye-watering 2.5 in clinic, which I certainly wouldn't be able to tolerate. And essentially what the in-clinic treatment does is it causes little puncture wounds or micro wounds, tiny little all over the face, which then the skin goes into healing mode, which will then produce collagen and more elastin. So once the skin has calmed down after about 24 hours, you can expect this really fabulous glow. Now, I personally don't think that the at-home version that causes the same wound healing effect that the in-clinic treatment does. What I think the at-home version does is simply causes these little tiny puncture wounds over the face, which then act as micro channels in the stratum corneum, the top layer of the skin, so that when you then apply your hyaluronic acid products afterwards, it will it'll go in so much better and be more effective. And I think that is what causes the glow for the at-home version. I think it's a little bit of a marketing tool trick when they say that the at-home version will cause extra collagen production. I simply just think it's the little puncture wounds created which cause the pop in the skin. Let's get on anyway. So as I say, you do it on a clean skin, preferably at night, because then when you sleep, the skin will go into recovery mode even more so you'll get more of a benefit. You start, the other thing, which I don't think I've got here, is the Clinicept spray, which you must be meticulous about cleaning it with. So anyway, or just the Olivia Wilson comes with its own little antiseptic spray, so do make sure, it's imperative in fact, that you're very, very meticulous about the cleaning of it. Okay, so this is how I do it. I start on the neck and I try and go in long motions. I try and do not too many small motions, because that will just cause too many little punctures. Now, as I say, I'm using the 0.3 millimeter. It's not comfortable at all. And I personally think I think you should start with a 0.3 and see how you go. So I'm just doing the neck. Now, I'm not going to go over the throat. The neck, as we know, has got much more delicate, thinner skin than the rest of the face. So do go very gently. You definitely don't press hard. You don't want to draw blood. Then I'm going to start on the face. They say you can do this twice a week. I personally think that's too much. I have been doing it once every 10 days or so. Now, it's not the most pleasurable experience. The more I've done it, the more I've got used to it. I don't know if you can see, but I am going quite red, which is totally normal. So I'm continuing with the long sweeping motions, not to do too many like that. I will do a few of those. Now that's quite painful in that area, ouch. Don't go over your lips, definitely don't go over your eyelids. I really think that it can help the appearance of fine lines, especially here. For those people that aren't doing Botox, or I mean, if you are doing Botox, you'll get even more of a smoother look. And if you're not doing it, I really do think that it will soften out some lines. Oh, it is quite pinchy there, but I'm still talking, and it's quite good on those 11s. Yes, so I'm not actually going to do that much more. I'm going to leave it at that. As you can see, it's gone a little bit pink, and all I follow with now is the hyaluronic acid serum. I use my Estee Lauder Advanced Night Repair, which you know I'm a huge fan of. I don't use anything else for 48 hours actually, because I think that you just it's just simply too stingy on me. The brilliant Kate Somerville, this new Delicate Recovery Serum, is an absolute winner if you really have gone overboard and you're wanting to reduce inflammation and redness, and for anything actually, even sunburn, that's fantastic. But yeah, so just do a hyaluronic acid serum, Medicate, do a wonderful one, or whichever brand that you're using that you like. If you go running or you're in the gym, obviously not at the moment, but afterwards, the day afterwards, it can be a little bit stingy as if your face gets a bit sweaty, so that's totally normal. But yes, just 48 hours of hyaluronic acid, and really I have just noticed my skin has got a really lovely glow about it since I've been doing it. So I'm going to continue. I had some cheat notes here, I wonder if I've said everything. I think I have.